Now we want to talk a little bit about the history of ThedaCare's trauma program. Early on in your career, you helped build the trauma program here at our Neenah campus, go on to later become the very first Level 2 trauma center north of Milwaukee. What was that like for you?
Well, it was exciting. One of my goals when I relocated from training in Chicago to northeastern Wisconsin is have the vision to create a trauma center. There was a crying need in our area. Prior to our having our trauma center, people would be going all the way to Milwaukee or Madison, which they're not close. And time is everything in trauma, and having long delays and long transports oftentimes is the difference between life and death. So having this type of trauma system, the capabilities to take care of the people who are severely injured, I knew was going to have a big impact on the community.
That's it. So important, right?
Oh, absolutely.
Now, building the trauma program involved recruiting some top surgeons and creating that vibrant rehabilitation center. It also included raising money for ThedaStar. So how do those resources that we now have impact Northeast and Central Wisconsin?
Well, all of those are huge factors. You could have the greatest facility in the world, and if you don't have the people to take care of the patients, starting from the nursing staff or respiratory therapists and obviously the trauma surgeons, but all that coming together is tremendous. Our area is somewhat unique. I mean, everybody thinks of the Fox cities, that everything is fairly close, but we serve people way outside of that area. We take care of those folks out in Waushara County or Green Lake County or Shawano County or along the lakefront where the clock is ticking when they're injured. And to be able to have the communities to come together along with business leaders and ThedaCare to have a aeromedical transport system is huge. There have been thousands of people's lives that have been saved by having ThedaStar being able to transport patients from the scene or from a smaller hospital that doesn't have the resources to take care of those patients to our facility where you could get definitive care.
What an incredible impact.
Yeah, it's amazing, as you go through your career and you run into people that, they look up in the sky and they see ThedaStar going by and they know probably one of the biggest reasons they're still alive is because of that helicopter.
Yeah, so impactful. Wow. Now, your work also extended beyond the walls of the hospital with programs like Focus, which teaches high school students about the dangers of distracted driving. Talk about the impact of that to young people.
We recognized very early when we started the trauma program that we had a lot of folks, high school kids, when they first got their driver's license, that were getting involved in tragic accidents. And there is no worse phone call or meeting that I have when I have to tell some parents that their 16-year-old is either dying or is dead or has some horrible injuries. So if we could prevent that from happening, that was really important. So it started off as the party at the P.A.C. and now it's Focus, where we take high school students after they have their driver's license and they spend a day with us. And we really emphasize on what can go wrong if you're not paying attention, distracted driving, if you don't wear your seatbelts. And the issues have changed. We used to talk about alcohol in driving, which obviously is still a problem, but texting and driving, where we have cars that are home entertainment centers now compared to when I learned how to drive a car, it is a real risk.
Now, finally, some big changes happening here at the Neenah campus, a $100 million modernization project. It's going to provide some greater access for the trauma care program. What does the future look like here?
Well, it was much needed, for sure. We've become a very busy trauma center, as you know. So in order to deal with that kind of volume, we really needed to ramp up our facilities. And this building project impacts a lot of things in healthcare, but certainly the trauma program. We're sitting here on a brand new helicopter pad, which is literally a stone's throw from the emergency room compared to where we were. And again, time is everything. So to be able to get from point A here into our trauma room where we can start delivering life-saving care is very, very important. Having large, spacious rooms to work on folks when they need our help. Having imaging, specifically CAT scan, right through a door where we can just roll in there and get that done. Because again, we're on the clock. We know if we can provide definitive care within 60 minutes of when you're injured, the chances of you living through this go up huge. So it's going to have a huge impact on the care we're able to deliver to all the people throughout northeastern Wisconsin.
Incredible. Thanks so much, Dr. Georgen, for joining us today and for all that you do for our communities.
Thank you.